Hi everyone, and welcome to the Digitodontics webinar series. This is Mahmoud Al-Bashti with you today from Digitodontics International Academy. It's our pleasure and honor to welcome our guest speaker, Dr. Olivia Kerouredan, from the University School of Dentistry, University of Bordeaux, France. Dr. Olivia will share with us her experience in bioprinting strategies for the vascularized bone tissue engineering. Dr. Olivia is an associate professor and the head of the Department of Restorative Dentistry, Endodontics at Bordeaux University Medical and Dental School in France. In 2011, she graduated with a Doctor of Dental Surgery, DDS, from the University of Rennes 1, and in 2015, she got her master's degree in the cellular biology, physiology, and pathology from the University of Paris Nord, Paris 13. In 2019, she obtained her PhD in cellular biology and pathophysiology for the research project of laser-assisted bioprinting for bone tissue engineering, and that was from the University of Bordeaux. Her research interests include cellular cooperation in bone regeneration guided by the laser-assisted bioprinting, the creation of vascular structures in vitro, and establishment of the PSK-RNF plasmid library. Recently, she spent 1 year in Japan for the JSPS postdoctoral fellow at the Institute for Life and Medical Science Lab of Biomaterials at Kyoto University, Japan. So during this session, Dr. Olivia will share with us her experience in bioprinting strategies for vascularized bone tissue engineering. She is a pioneer in the field of bioprinting and tissue engineering. With her extensive expertise and innovative approach, she has been at the forefront of advancements in the creating vascularized bone tissue using cutting-edge bioprinting strategies. This webinar is a golden opportunity to gain insights into a field that holds immense potential for the transforming the landscape of dental and medical therapies. So just before Dr. Olivia starts, I would like to mention that you can leave down your questions in the Q&A section. And once Dr. Olivia finishes her presentation, she will be happy to answer all these questions. So without any delay, let us once again welcome Dr. Olivia with us. Olivia, I think the stage is yours. Please share your screen.
Okay. So thank you very much, Mahmoud, for your nice presentation and this invitation to this webinar. And I also would like to take this opportunity to congratulate you for this new platform. It's a very interesting webinar, and I thank you so much for giving me this opportunity to present my research work today, because it is research and not clinical practice. But I think that it is a subject of interest for clinicians. So it's a good opportunity to connect research and clinical practice today. So I will talk today about bioprinting strategies for vascularized bone tissue engineering. So thank you for your introduction. So yes, I am an associate professor in the Faculty of Dentistry in Bordeaux in France. So I have 3 activities: a teaching activity related to restorative dentistry and endodontics, but also teaching activity related to biofabrication for bone tissue engineering for master students, for example. I also have clinical activity mainly related to restorative and aesthetic dentistry, but also I am working in the rheumatology department with patients affected by osteoporosis or scleroderma, or patients with rare bone diseases such as osteogenesis imperfecta. So many things related to bone and bone diseases. And my research topic are mainly focused on bone tissue engineering with biofabrication technology, and especially laser-assisted bioprinting. So previously, I worked on different topics, mainly focused on vascular and bone tissue engineering with the involvement of biofabrication techniques. So today, I will talk about this work. So as you said, I just came back from Japan now. I spent 1 year in Japan. This collaboration started in 2021, following a workshop on additive manufacturing organized by the French embassy in Japan. And I started to collaborate with Professor Yasuhiko Tabata from the Laboratory of Biomaterial in Kyoto University, but also Professor Chiaki Kitamura and Dr. Ayako Washio from Kyushu Dental University. And after that, I received a fellowship from the Japan Society for the Promotion of Science to spend 1 year in Kyoto University. So today I will also talk about this work I made in Japan in this laboratory. So firstly, let me briefly introduce the context, the large context of this study. Today, you know that diseases inducing bone loss are a major health problem. More than 2 million bone grafts are performed annually, and different therapeutic solutions exist, such as autografts, allografts, xenografts, or synthetic biomaterials. But all have limitations and risks, and that's why bone tissue engineering aims to generate new implantable bone substitutes with optimized properties.